Hi, I'm Dr. Parker Haley, and today we're going to talk about dental implants. Now, there's a lot of questions that we get in our office about dental implants, about what they are, why we use them in dentistry, and we made a video just to kind of help clarify any questions that you have. First thing is that, why do we use them in dentistry? Now, in dentistry, if someone comes in, let's say, with a tooth that happened to be avulsed because from trauma or from an accident, or they have a large cavity and the tooth has to be removed, the standard of care now is to do a dental implant to replace the missing tooth. Now, what is a dental implant? Dental implant has three parts. There's the first part, which is the implant, which is going to act as the root. Then there's a connector, and then there's the crown, which acts as the tooth on top. Now, we have three cases today that we're going to go through to help explain that. So let's go ahead and look at the videos and go through each one. The first case we have is a patient came and has a missing tooth on the top. Looking at the missing tooth, we first look at the bone. We look at the bone, make sure there's an adequate thickness. Once we do that, we go ahead and look at the bone and we make an implant site. From the implant site, we place the implant into the bone. It's a titanium screw. Once it goes in the bone, we put a healing cap. The healing cap sits in there and we let it cook for about 4 to 6 months, let it integrate into the bone. Then you come back, we take the healing cap off, then we put on the connector. Now from the connector, we have to take an impression of it and send it to the lab. The lab will fabricate you a new crown, which is the tooth, and then we put that on top, we cement it in, and then your missing tooth is replaced. Now we have a second case showing a missing tooth in the front on the bottom. Now again, same thing. You place the implant, put the healing cap on, wait 4 to 6 months to let it heal, remove the healing cap, we put the connector on. From the connector, take an impression, send it to the lab, and they come back with your new crown. Now our last case is the most common case where it's a missing molar on the bottom. Now again, we look at the tooth, look at the area, make sure the bone's nice and thick, make an implant site. We place the implant into the bone. Once the implant is placed, we go ahead and put a healing cap, let it heal 4 to 6 months. Once it heals, you come back, we uncover the healing cap, remove it, put on the dental connector. Once the connector's on, we take an impression, send it to the lab. The lab fabricates you a new tooth, a new crown. We put that on top of the connector, and then you're done. And that is the dental implant. Well, thanks for watching this video. If there's any questions, visit us at LaderaDentistry.com, and thanks for your time.